we had a question for Mary relative to hogs that are raised conventionally versus those without antibiotics. Do you have any measurements in terms of welfare? Are there differences, and can you speak to that?
I don't have the exact figure. I do know that the antibiotic-free pigs do cost us more to produce. And it's mostly an average daily gain, I believe, in feed conversion. I know there is a cost for Smithfield to raise them without antibiotics. But again, our system doesn't allow us, if they need care, they get care. They just get separated and marketed out. Because the welfare issue, we don't even want to go there. So.
Yeah, question for Mary or Joel. We're approaching 24 months under VFD.
Who's asking?
Would you sort of give the audience your personal interpretation of how that's impacted the way you as veterinarians approach managing pig production?
It's not been terribly labor intense in our system because all of our pigs, I say that, on the East Coast, all of my pigs are fed out of my feed mill, so I don't have any toll mills involved. That's made things somewhat simple to implement there. For the other divisions that are dealing with toll mills, it's a little more complicated. We've always evaluated our feed additives. I mean, the calendar's marked if we make any changes, and we monitor that and look at performance and see if it's beneficial or not. We try to limit them as much as we can. I think the frustration is with the feed mills are designed to be efficient, and to be ran efficiently, they're max production. They make feed, produce feed, deliver feed, all but the Sabbath. On Sunday, it's repair and maintenance. So we don't like having antibiotics in feed because you have to do a flushing cycle, and it really kind of reduces the efficiency of the feed mill as we switch from one ration to the next. Did that answer your question?
Yes, Joel.
Okay.
I think the requirements have had the intended effect, at least in our practice area where we're working with independent producers. And so when the requirement to have a VFD came into effect, it's now required conversations between the vet and the producer that may not have taken place in certain circumstances because the producer was independent. These products can be administered without a vet's recommendation. So we've viewed this as a very positive thing in our practice. It has required more staff and expense on our part to be able to execute it, but we think it's the right thing for the industry, it's the right thing for the producer and the pig, and it's the right thing for the consumer. So I don't know if that answered your question either, but that's our perspective on it.
Yeah, just a quick follow-up. Do you think there are less antibiotics used in your system as a result of VFD in the feed?
I'm not sure, to be honest, because we didn't have a good measurement of feed antibiotics ahead of that, especially when we talk about our part data and how we're monitoring that now. It would be, my sense is that the feed usage has declined, but to what degree I don't know.
So we report antibiotic use, and ours did decline. We took a pulse out. It actually was more related to pig health than the VFDs, I would say.
Oh, go ahead.
I would just make one other comment, though. Your question stimulated a thought in my mind. I think with the requirement now for VFDs and the topic of antibiotic use being at the forefront of our customers' minds, we've had customers now asking for and supporting more disease elimination programs, particularly mycoplasma, high pneumonia, at the breeding herd level. A lot of the feed grade medication that's been used, at least in our customer base, has been because of respiratory disease. And so I think sort of bringing the feed grade use to the forefront or putting it in the spotlight has, I think, helped usher that in, which I think is, again, good for the pig and good for everyone. It's better to eliminate disease than treat it.
So I'd like to see if Joel and Mary agree with my take on within-system metrics. And I think that within systems, it matters, but it really doesn't. Grams per head, fine. And it's a driver to go back and look why, because I think you've both mentioned, well, we know it's an animal health cause, or we had a PRRS outbreak there, we had a breakdown in environment, whatever, and go back and looking. And when you start benchmarking, if the only reason to use the metric is to benchmark and discover why the differences are, use what works best for you. When we get into problems is when we start to get posturing between proteins, between production systems and marketing, or between countries, and then everyone starts jockeying for the metric that makes them look the best. And I think what you're doing is a pure example of using it for the betterment of animal health and looking at what's the driver of it from the animal health standpoint, and using that to let some see others and improve off the examples of others. When you say grams per head, good deal. You're monitoring it, you're using it for benchmarking. Excellent. I really like what both of you are doing.
I think one of the things that we were very cognizant of is we don't want to create a race to the bottom on antibiotic use. We think that's bad for the pig, is if all of a sudden the producer now is more concerned about, well, how do I get lower than all my neighbors? We don't necessarily think that's a good thing. It's about responsible use, and we need to measure. If we're not measuring, we're not being responsible. And so the first step is to make sure we're measuring, to your point, and let's pick a metric that allows us to do it and compare. Let's focus on not playing games. So
I agree. And I really suspect ours to fluctuate. I mean, it seems like about every 4 or 5 years we get a new PRRS strain in, and things get a little ugly. And I anticipate the use is going to go up. And then as things quiet down, hopefully our use will, not that antibiotics work against PRRS virus, but there's certainly a lot of secondary bacterial infections that follow that. So I don't expect it to be every year trying to one-up what we did last year. I hope we don't go there because, like you said, it's about the pig. It's about the pig.
Well, great. I hope this gave you a good grasp of the complexity of the issue, and even just a simple metric of measuring, as Mike pointed out, looking at what you use it for is critical. So with that, we're up against a break. So if we'd give our panel another round of applause.